Another important issue which you should know is about National Health Mission. National Health Mission is a mission started by central government in 2013. So, in 2013 this national mission was constituted by subsuming National Rural Health Mission and National Urban Health Mission. So, both were combined together to form National Health Mission. So, this mission is for 5 years. Okay. So, from 2013 it was up to 2018, but in 2018 it was decided that we will extend it by 2 more years to 2020. It is headed by a mission director, and there are some national level monitors to monitor the progress made under this mission. Okay. What is the aim of this National Health Mission? Its aim is to ensure universal access to equitable, affordable, quality healthcare services that are accountable and responsive to people's need. So, there should be access to healthcare for all the people of India should be having access to healthcare. It should be affordable to all of them, the quality should be there, and this hospitals and providers who give these healthcare services should be accountable to the people, and they should be responding to the needs of the people. So, the beginning was actually National Rural Health Mission, NRHM. NRHM was started in 2005. What you have to understand is that in the beginning our studies were saying that we do not have sufficient healthcare infrastructure in rural areas. There are very less number of doctors who are willing to function in rural areas or do the service in rural areas. So, because of all these things, this NRHM was launched in 2005 to provide the same things, accessible, affordable, quality healthcare to rural population. So, but it is a comprehensive thing which includes water, sanitation, education, nutrition, social and gender equality, training for volunteers. All these things were included in NRHM. But later, by 2013, government realized that the healthcare issues are not really, exclusive to rural areas. The same issues are faced by people in urban areas also, especially urban poor. So, government came up with National Urban Health Mission in 2013 to meet the healthcare needs of urban population with focus on urban poor. So, the same aims are there to making available essential primary healthcare services and reducing out of pocket expenditure was the aim of this National Urban Health Mission. Now, they combined both NUHM and NRHM to make NHM or National Health Mission. So, there are specific targets for National Health Mission. It includes reduced maternal mortality to 1 by 1000 live births, reduce infant mortality rate to 25 by 1000 live births, reduce total fertility rate to 2.1 for population control, prevention and reduction of anemia in women aged 15 to 49 years, prevent and reduce mortality and morbidity from communicable, non-communicable injuries and emerging diseases. So, even if there is disease, there should be reduced mortality and morbidity. Reduce household out of pocket expenditure on healthcare expenditure, that is why they came up with health insurance schemes. Reduce annual incidence and mortality from tuberculosis to half. Reduce prevalence of leprosy to less than 1 by 10,000 population and incidence to 0 in all districts. Annual malaria incidence to be less than 1 by 1000. Less than 1% microfilaria prevalence in all districts. Kala Azar to be eliminated, and initially the target was 2015. Elimination means less than 1 case per 10,000 population in all blocks. Initial target was to achieve Kala Azar elimination by 2015. Now, the target has not yet been completely achieved. So, the extension is there till 2020. Okay. This is about National Health Mission, the basics about National Health Mission which you should know. Now, coming to another aspect, projects under Kerala state government. See, what you have to understand is that you should be knowing all the projects which is undertaken by at least Department of Homeopathy, and if you can know little bit more about projects taken by health department also, that will also be good. Now, Ayushman Bhava is a project under Department of Homeopathy, Government of Kerala. The aim of Ayushman Bhava is to eradicate and resist all the lifestyle diseases like sugar, cholesterol, hypertension, heart diseases, hypertension related heart diseases, all these lifestyle diseases, obesity, all these things are to be eradicated from state of Kerala under this program Ayushman Bhava undertaken by Homeopathic Department. And the uniqueness of this Ayushman Bhava program is that it incorporates different systems of medicine. So, homeopathic medicine along with naturopathy and yoga is advised under Ayushman Bhava program. So, undisposed waste materials, pesticides, mental pressure, fast food, etc., along with the lack of exercise is detected as the reason for lifestyle diseases under this program, and our aim is to reduce incidence of pollution, incidence of mental pressure, then control fast food, generate awareness in the people so that they will be limiting fast food, then encourage people to do more exercise. All these things are undertaken under Ayushman Bhava program. So, obesity, hypertension, heart attacks, liver disorders, cancer, etc., are covered by Ayushman Bhava program. Smoking, alcoholism, lack of exercise, personal hygiene, all these things are trying to be limited by the help of this program by creating awareness in the people, conducting awareness programs, giving disseminating information to the public, etc., as well as genetic screening. Screening is also an element of this program to identify the risk factor, genetic risk factor for these diseases. Then as I already told, it combines homeopathic treatment along with yoga and naturopathy. There is also general yoga treatment. There is lifestyle disease counseling for people who are visiting the centers. Diet and nutrition consultation will be there, where you will be advised what should be the diet you should follow based on your nutritional habits, what all should be the nutrients which you should get. Then stress management programs will be there, meditation programs will be there. Okay. This Ayushman Bhava will conduct medical camps in different parts of state to identify the people who are prone to lifestyle diseases. There is also IP facility in some selected hospitals. One hospital from each district is selected to have IP facility under Ayushman Bhava program. Okay. This is about Ayushman Bhava program, which is undertaken by Homeopathic Department to help with lifestyle diseases in Kerala. Another important initiative of Department of Homeopathy, State of Kerala, is floating homeo dispensary. You have to understand that there are inaccessible areas in Kerala because of the backward areas which is waterlogged and across the backwaters of Kerala, especially in Kuttanadu, Haripadu, etc. There is this floating homeo dispensary. Okay. The first floating homeopathy dispensary was started in Kuttanadu in June 2013, and the subsequent homeopathic dispensaries were started in Haripadu and Chambakulam in September 2014 and September 2015. So, these are the three floating homeopathic dispensaries. Floating homeopathic dispensary of Kuttanadu is named as Boat 1. It provides service to 21 centers of Kainagari, Nedimundi, Pulingunnu, Kavalam and eastern parts of Alappuzha municipality, having a population of approximately 1,50,000 people. Then floating dispensary of Haripadu is the boat number 2, which provides its service to 19 centers of Trikunapuzha, Arattupuzha, Karuvata and Purakkadu panchayats. There also population is roughly the same. And the third floating dispensary is at Chambakulam, what is named as boat number 3. It caters its service to 15 centers of Chambakulam, Nedimundi, Tagari and eastern parts of Ambalappuzha, South Grama Panchayats. All these panchayats are covered under this third boat. Okay. Here the population is little less, around 1 lakh is the population. Okay. This initiative is to provide accessible health care to people who are residing in inaccessible places. So, this is a significant step, and if you are from any of these areas, there is a higher possibility that questions can be asked about this initiative. Okay. Now, another important health topic which is globally important is neglected tropical diseases. Why they are called neglected tropical diseases? These diseases are neglected because it is seen more in tropical areas among the poor people, and the required attention is not given by the health authorities for these diseases. Not only health authorities, apart from the health authorities, even the private research institutions and other organizations also give less importance to these issues of these neglected tropical diseases, these diseases. So, there are a lot of diseases which are mostly seen in tropical poor, which is designated as neglected tropical diseases. It includes ascaris, Buruli ulcer, Chagas disease, dracunculiasis, hookworm, trypanosomiasis, leishmaniasis, leprosy, filariasis. Okay. So, you should be having some information on all these diseases, but I know it is a very limited time span I can spend with you in this video. So, I am not going to elaborate all these things. What I am trying to put into your notice is that you should be having some basic understanding about prevention, treatment and the issue of neglected tropical diseases, so that you can have some answers ready when it comes to your interview. Okay. So, neglected tropical diseases afflict world's poor population and historically have not received as much attention as other diseases. About more than 1 billion people, primarily poor population living in tropical and subtropical climates, are affected by these diseases. They are frequently clustered together because the people, poor people tend to live together, and there will be cross infection between each other. So, each of these infected people, especially people living in slum, etc., will be having more than one neglected tropical disease at the same time. This is also a crucial factor which warrants urgent attention to neglected tropical diseases. Now, let me discuss some point you out some additional topics which you should be prepared with. One is reach, and I am not elaborating about the topic because it is already mentioned by, and few points were discussed by Dr. Harish Babu in another lecture. So, reach as the epidemic control procedure under homeopathic by Department of Homeopathy, then Sidalayam, Janani program, Sadgamaya, Chedana, Punarjani. All these things I think was discussed by Dr. Harish Babu. You should listen to that, and if there is something additional that you need, you should refer to the website of the Department of Homeopathy and find this out. Okay. And some diseases which are important in India as a whole is tuberculosis, because India is the country which is having maximum number of tuberculosis cases. Malaria, India is highly prone to malaria, so malaria. Leprosy, maximum number of cases of leprosy across the world is reported from India. So, leprosy. Then you should know about diarrheal diseases, especially in the context of flood in Kerala as well as in context of high monsoon in Kerala. You should know about diarrheal diseases and waterborne infections. Then STDs, especially HIV and AIDS, is a particular topic which you should go through. Then you should also know about immunization schedule, immunization program. You should be able to show the board that you know about public health initiatives. Okay. Then anemia is a critical issue in India, especially anemia in pregnant women, anemia in lactating women, and anemia in young children. So, this and about anemia and its epidemiological aspects you should know. Then mother and child health issues, iodine deficiency and goiter. And when you come to Kerala, because there was a recent incidence of snake poisoning in Kerala which attracted news, you should know the basic minimum things about snake poisoning, what should be the first aid for snake poisoning, which all are the institutions near to your college where you studied, or to your home where you are residing, or your clinic where you are practicing, where anti-venom for snake poisoning is available. All these things should be known to you. Now, what I am telling you is that these are some takeaways which I can give you. But as you know, the interview may not be limited to these topics. It can be from anything. Now, you have to decide what all you should study and what all you should leave. You should go through at least these many things, but additionally whatever you can study, you study. But let me tell you, I want to repeatedly tell you this, that your mark in interview is not a deciding factor for your service. It is only a deciding factor for how faster you can get the service, whether you reach the service earlier or later. So, it is not compulsory for you to know everything in an interview. If you do not know anything, you should be confident enough to tell the examiner that you do not know it, okay, or you are not clear about it. Okay. And if examiner is asking a question and you are not able to answer the question, you should be clearly telling them that you cannot answer because you do not know, or if you cannot hear that question properly, you should politely ask them to repeat. Ask them, pardon, please repeat the question, or simply you can say pardon, and the examiner will repeat the question. Do not jump into answer without hearing the question properly. And also you should listen to the question, allow the examiner to complete the question and then only start the answer, because the question which may be asked by examiner may be about something specific about that disease, not the entire thing about that disease. So, these are the things which you should take care of. Then additionally, you should stop studying at least around 12 hours before the exam. You should not take any study material to the interview venue and start reading there. This is not a viva examination. Here, your knowledge is not tested, but your ability to apply the knowledge tested and your presence of mind tested. So, do not be worried about what you do not know, but be worried about presenting what you know in a better manner. That can be done only when you are prepared beforehand and not by studying on the day of examination morning.